Today's town hall was developed in partnership with the Yellowstone County Economic Response and Recovery Team. This group is a public-private partnership between Big Sky Economic Development, the Billings Chamber of Commerce, Downtown Billings, Visit Billings, city and county government, as well as numerous private business. The mission of the Economic Response and Recovery Team is to support and sustain our local businesses during the time of significant economic distress and prepare the community for economic recovery and future growth and development. We will get started at 10 a.m., just about 2 minutes from now. I'm John Brewer with the Billings Chamber of Commerce. If you have questions, please post those in the Q&A box at the bottom of your Zoom screen. And John Stepanek from KTVQ will be facilitating those questions, making sure they get to the right presenters today. Recently, the Yellowstone County Economic Response and Recovery Team distributed just about 38,000 free masks to area businesses. We developed the campaign Mask Up. You'll see that on there. And I'd like to thank Riverstone Health as well as St. Vincent Healthcare and the city of Billings for donating those 38,000 masks so we could distribute those again at no charge to area businesses. Following the governor's announcement last week, the chamber produced this summary of his mask wearing directive. This poster contains the essentials your business needs. And these materials are available at www.yceconomicrecovery.org. Again, yceconomicrecovery.org. And that information is a good summary for your business to utilize. In addition to that, the chamber produced this poster. The governor required that at the entrances of your business that you use this language. You don't have to use this poster, but this is the language that you would need. Again, this material is available for you to download and to use at your business as you wish. yceconomicrecovery.org. You can find all of those materials. And once again, I'm John Brewer with the Billings Chamber. We'll get started in just about 1 minute. Over to Mike Nelson. Mike is the owner of the Northern Hotel in downtown Billings and is the current chair of the board for the Billings Chamber of Commerce. Mike, why don't you get us started?
Thanks, John. Good morning, everybody. And on behalf of the Billings Chamber of Commerce, I want to welcome you to our town hall meeting on this very important topic, wearing a mask, masking up, and that masks mean business. At the Northern Hotel, masks have been a part of the discussion since about the 13th of March. Until recently, wearing of a mask by our employees was a matter of choice, and because we decided as a team to respect the diversity of opinion amongst our workforce. But you know, the subject got to be more and more important, and as time went by, it became very apparent to us that wearing a mask was going to be something that even the public was going to demand. So we opened the subject up for discussion. And after a series of town hall meetings, it took about a week and a half to 10 days to go through, we decided as a group to adopt a mask standard. And that standard was everybody universally would wear a mask whenever they were amongst other folks. And I'm really proud to say that we did that several days before it became the law of the land. So we're proud to say we're wearing masks by choice. Why did we do this? Well, two simple reasons. The first, we all realized that this act is no more than just doing a favor for your neighbor. And really, that's what I want my business to be about. We want to be a good neighbor to all the folks around us. And two, it was very apparent through studies and through talking with our guests that our customers wanted to feel safe and comfortable at my hotel. Go figure. So if my customers want it, I'm going to do it because I am in the business of pleasing my guests. By the way, masks were universally adopted and accepted by my employees, and we haven't heard any complaining or grumbling. And some people look really great in a mask, myself included. I can't help it. So as we go along and the public is educated and realize that also it's an easy thing and a good thing to do, I'm sure that they'll accept it also. I'm really excited to open this up to a Tele-Town hall meeting. I'm excited to get the subject and the topic out for conversation like we did here at the Northern, and I'm excited to see what comes of it. I'm really lucky to be able to introduce John Stepanek, KTVQ's own John Stepanek, and hero to a lot of us, to facilitate this meeting. So, Mr. Stepanek, take it away.
Thanks very much, Mike. It's always a difficult act to follow you. So I'll do my best as we get going today. This is a very important topic, and obviously it's been one that has been met with a great deal of controversy lately. You know, back in February and March, we started covering mask issue, and it was then that a lot of the federal health officials were saying we shouldn't wear a mask. Dr. Anthony Fauci, one of the leaders, U.S. Surgeon General, Dr. Jerome Adams, advised the public not to wear a mask back in February. But since that time, Fauci, Adams, CDC, World Health Organizations, most of the health leadership teams have done an about face with the mask guidance. And as scientists have learned more and more how easily this coronavirus can be spread into the public, they've not only say that we should wear a mask, that it's critical to wear a mask if we want to protect the economy and get our schools reopened and in the end save thousands of lives. So that's kind of where we are with the mask situation, and it certainly has caused a great deal of consternation amongst those who don't want to wear a mask, feel that it's a violation of their personal freedom, and we're going to get into that today. So I'm looking forward to that discussion. So Governor Bullock did issue the mask initiative back on Wednesday, and that order says that face coverings over the nose and mouth must be worn in all counties in Montana with 4 or more active COVID cases, and that obviously includes Yellowstone County. And the mask directive says that for your business, the point of entry, the public must have a clearly visible sign posted stating that the mask or face covering use is required for everyone 5 years and older. So to jumpstart our conversation today, we are going to turn things over to Glenn Hammer. He is the President and Chief Executive Officer of the Arizona Chamber of Commerce. And he is going to share his perspective from one of the most impacted states in the country. Just for a little bit of comparison, right now Montana has charted about a little bit over 2,600 active cases. In Arizona, it's 145,000 active cases, and they have seen a June and July spike in Arizona. Upwards of over 2,800 deaths have been recorded in Arizona. Well, Glenn Hammer joins us as President and CEO of the Arizona Chamber of Commerce. He has been there since 2006. He's overseen the organization's development into one of the most respected pro-business public policy entities in that state, notching some significant wins in tax policy and education, regulatory reform, healthcare, tort reform that have all greatly enhanced Arizona's economic competitiveness. His previous career stops included some legislative activity, Chief of Staff to Arizona Congressman Matt Salmon, and the Executive Director of the Arizona Republican Party during a winning U.S. Senate race. Also served as a legislative assistant to Arizona Senator John Kyle, where he worked on a range of issues, including the Jerusalem Embassy Act of 1995. I'm sure that he has never been busier in his life. So I am going to turn things over next to Glenn to give us some perspective from one of the hardest hit states in the country. Glenn, it's all yours.
Well, thank you very much for that introduction. And I'll admit it's been a while since I've been in Montana. I believe it was 1986 or 1987. And you have just an absolutely beautiful state. And I want to say that John Brewer is one of the great chamber leaders in America. And we're proud to have him as part of the U.S. Chamber's Committee of 100 top 100 chamber leaders across the United States. And you're right that Arizona has been hard hit, but I come to you today with a bit of good news from Arizona, and it's connected to the topic at hand, which is the importance of masks. And I want to commend your governor for pursuing a mask mandate, because the bottom line is that these mandates work. And I noticed the chairman mentioned some important comments in terms of the position that I believe a lot of us were in across the United States, and that's that we encouraged people to wear masks. We saw it as a civic responsibility. Your comments, John, are right on. That early on, the healthcare officials weren't simply neutral; they were actually opposed to the public wearing masks. So, some of this confusion is not exactly, some of it's political, but not all of it. First impressions matter, and a lot of the public health officials at all levels, the global, and the national level, they blew it. There's no other way to put it. And I do believe that has made it more difficult to shift. However, given that this is a novel coronavirus, and sometimes we have to stress novel, we've never been faced with this disease, and there's still a lot that we're learning about this disease. In my opinion, pointing fingers for past mistakes is not terribly productive. What is productive is looking at the current science and looking at the current trends. And what's very, very clear is that the mitigation measures that citizens can take and that businesses can and are encouraging, social distancing, not congregating in large crowds, washing your hands and using hand sanitizer, and of course, wearing a mask. These are the types of actions that we can all take, each and every one of us, that have a dramatic effect. So in Arizona, our trajectory was we were not hit anywhere near as hard as my home state, my birth state, New York, and that region. If you recall, when this came to the United States, probably came mostly from Italy. It hit Washington State hard for a small period of time, but the states that really got walloped were the northeastern states, and a lot of people were thinking it's density and we'll do what we need to do, and we did do basically a soft shutdown. We kept a lot of the economy open. We never closed manufacturing, we never closed mining, we never closed construction, but we did close in-house dining and those types of things. So we came out of the first phase of this in, say, early May with very, very low numbers. And so we started opening back up. And people, the New York Times, Washington Post, the national media, they like to look at the numbers and say, all right, did you open up too soon? The answer that I have is no, we didn't open up too soon. It's how we opened up that was the issue. And there were a few areas that weren't supposed to be opened up, like bars, that did basically open up, and they used loopholes. And the fact that Arizona was more open than other states, and we're a mobile country, meant 5 miles from where I live, Scottsdale, Arizona, became Party Central, Arizona, and Party Central America. And that was not a good thing. And I think that lit the fuse. So the governor has been very clear, almost really from day one, wearing a mask is a good thing. But we have libertarian leanings in this state. We're a Western state like Montana, and felt that, up until the cases really exploded, that mandates were probably not the best way to comply. We had all sorts of protests going on from, I'd say, more the right in terms of libertarian type arguments. So it's not just passing mandates or laws, it's getting compliance. But what happened is that the cases did rise very quickly. The hospital beds did hit a very concerning point, and the governor decided to pivot and say, okay, we have a lot of mayors and county executives that want mask mandates. I'll give them that ability to do so. And like a snap of a finger, for 90% of the state passed, and readily accepted. So we went from a situation where if you went out in a store and did this, you were looked at as the exception, to within about a 1 week period, it completely flipped. And now what we have is people are wearing masks. Businesses are with the government's backing enforcing these mandates, but they're city and county mandates. And what are we seeing? We are seeing a significant decline in the positivity of cases, as well as our emergency rooms, our hospitalizations. All of the leading indicators now in Arizona are moving in the right direction. So masks work, and we would just say mask up Arizona, mask up Montana, mask up Arizona. And if we mask up, the CDC director, Robert Redfield, just said over the weekend, if we all mask up, if we take this simple action, within 4 to 8 weeks, the entire country could be in a dramatically better place. So again, thank you for the chance to be here. And I really admire what you're doing in Montana.
All right, thank you, Glenn. I appreciate that. We're going to be joined now by Rayleigh Summers Flanagan. She is the Deputy Legal Counsel for the Office of Governor Steve Bullock, and she was instrumental in helping draft the directive that was put into effect last Wednesday. Rayleigh, I'm going to give you a chance to go over the highlights of that directive and give us some clarity. We have already had a question about this, so I'll follow up with it, but we need some clarity on the directive that was written up by your office, and we'll give you a chance now to share some of those highlights.
Great. Thank you so much, John. And I am super thrilled to be joining all of you. I did work closely on getting the mask directive in good shape and getting it out to all of you. And I'm eager to answer questions. So, throw them out, and John will relay them to me as we go along. Just to start, I think it's helpful to maybe do a quick overview of sort of commonly asked questions, try to really make clear what it is that we are requiring of folks in the business community, and also, anybody who's having big gatherings, really. And the basics are this. We have 2 spaces that we are requiring face coverings. One is indoor, one is outdoor. In the indoor spaces, the things that we are looking for are businesses that are open to the public. So the question is, are you a business that welcomes folks in from the street? Is it an employee-only area? That sort of thing is sort of the first set of questions that you want to ask yourself. If it is an area, say for example, that you have an office, and in the front of the office you have a reception area, maybe a law office, maybe a place where you have sort of a warehouse in the back and you have a reception area in the front. Those are going to be areas where you're actually going to have sort of a split, right? The folks who are public facing, those receptionists and the people who are coming in and out of the front, they need to be wearing masks for their own health and safety, and for those of their customers and the folks in the back as well, because if they're walking back and forth, they may well be sort of exposed to lots of folks. The bottom line is that this is sort of a question that you ask yourself, like, do we have people from the public regularly coming into this space? If the answer is yes, masks are required there. And then we also have areas that are not open to the public. If you're in your own office, for example, all of us who are visible on the screens, we are in our own offices. There's nobody here with me. It's totally okay not to be wearing a mask, obviously. In your own home, things like that. So then we've got the outdoor spaces. The outdoor spaces is a little bit complicated in the sense that it's really areas where social distancing is either not possible or it's not being observed. And so that is something where you need to sort of look around and think, is this a space? Think, for example, Bin 119 downtown in Billings or Thirsty Street. Those are areas that have really nice outdoor spaces. But if you've got a whole bunch of people crammed into that outdoor space, you can't social distance, right? So you can't get far enough away from each other that you can safely not be transmitting COVID-19 if you are carrying it. And so the bottom line is that you want to be wearing your masks in those areas. Similarly, that's an area where it's not possible. Similarly, you've got areas where, for example, say that you're going to a wedding and the wedding is outdoors, it's great, lots of space, but everybody is all close next to the bar and everybody is sort of shoved into that space. That's not an area where you're practicing social distancing, right? Even though you're able to, you're not practicing it. So the idea is we want to have masks there as well. So those are two pieces that I think, sort of the indoor and the outdoor. I'm happy to answer questions. I know that it can be sort of individually specific. So yeah. And then a couple of other things that I think are helpful to keep in mind is that, you know, businesses are going to be confronted with people who are resistant to this, and we understand that. And your job is to enforce in good faith, in the sense that you are communicating clearly what the rules are, and you are doing your best to keep folks wearing masks. If somebody tells you that they have a medical condition, we are not advising you to question that. We don't want you to ask them for documentation. We just want you to say, okay, understood. That being said, we're asking you to practice this in good faith, right? So the idea is that we don't want to be posting signs that say, here's how you evade the mask directive. That's not good faith. So are you within a reasonable exception to the mask directive? Super. Then you're in good faith waters all the way. If the goal of an activity is to try to avoid it, that's not so much good faith. And I saw that we had one question. I don't know, there may be more and I couldn't read them all, but maybe I should ask John to just relay them to me.
You know what, we're going to do a circle back to the questions after we introduce our third guest. And Rayleigh, we have a whole bunch of questions in the queue, and it looks like a lot of them have your name on it. But first, we're going to say good morning to Dr. Bob Merchant. He is the Chief Medical Officer at Billings Clinic. He is a pulmonary and critical care physician. He's been with Billings Clinic since 1991. I think I've known Dr. Bob since that day. He is going to join us for an opportunity to share some data and science behind the value of what mask wearing and how it might slow the spread. So Dr. Merchant, the stage is all yours.
Well, thank you so much, John. And first, I'd just like to thank the Chamber for really leading this work that's so important to keep our community open and also to keep our people safe here. You know, this morning reading the paper, I was saddened to hear of 2 more deaths in our county. We're in the middle of an international crisis. We're in the middle of an international pandemic, and how we respond now will really affect our lives, our community for the months ahead. In March, when we think back and realize when COVID was first detected in Montana, we contained it by sheltering at home, and that worked. But it saved hundreds of lives, but it saved hundreds of lives at a cost. It hurt the economy. It also hurt the health of our people. When people sheltered at home, they didn't come in for essential services, medical care. And we're seeing this now where people are coming in who had heart attacks and strokes at home and did not come in for the medical care they needed. So again, that was effective, but it was at a cost. We've learned a lot since March. March was a long time ago. When we talk about COVID time, that was ancient history. We've known about this virus since December of last year. We've learned so much every single week, every single month. And what we're learning now is that as the cases are increasing in Montana, we don't need to shut down. That's not something that we should be doing. We can be smart about this. We can make use of what we've learned. We know that COVID is an infectious disease, but it's not crazy infectious. This is something that can be relatively readily contained. In Billings Clinic, for example, where we've probably cared for more people with COVID than any other place in the state, we've had 0 cases of COVID transmission here. We've had 0 people that have been affected by COVID on our campuses. And we've done this using a really very simple formula. We've not resorted to expensive equipment, elaborate techniques. The formula is simple. Universal masking is a critical component of that, but there's other components: keeping 6 feet apart, hand washing and cleaning surfaces, don't come in when you're sick, and also to have the courage to remind each other if we see each other slipping up. That's the formula, 5 simple things. One of the important things about that formula, though, is you can't take any one of those individually. These are complementary. We have to do all of them. The 6-foot distancing is something worth spending a little bit of time on. The reason that we need to be 6 feet apart is that COVID is spread by small droplets, that when we have COVID and we have it in a respiratory symptom, that virus comes out in droplets. It comes out when we talk, when we simply breathe, when we sing, when we cough. And there's things we can do. We can cover our cough, do things like that to keep the droplets from spreading. But these are relatively heavy droplets. And as we cough and speak, they drop 2-3 feet in front of us. They usually don't make it past 6 feet, but there's not a magic barrier at 6 feet. They can make it past 6 feet. They can, we've had plenty of cases documented where they travel 15, 20 feet and people have been affected 15, 20 feet away. And so this is a little bit of a complex formula. And Rayleigh was alluding to this, that if you're 6 feet apart outside, that's one thing. But if you're 6 feet apart inside in an enclosed room with poor circulation of the air, that's a very different thing. So that's why being 6 feet apart in and of itself isn't the solution. Universal masking, hand washing is also really important, that these droplets, they come out of our mouth, they drop onto surfaces. If we then touch those surfaces and then touch our mouths or nose or eyes, that's another way that we can acquire COVID. So frequent hand washing and cleaning surfaces is also important. Don't go out when we're sick. We know that when you're sick, you're most likely to spread it. The 5th thing that is really important is that in our healthcare community, we know that these things are hard to remember. They're just not part of what we are used to doing. And so we have to have the courage to remind each other to do what's right for the common good, to do what's right for the community. Speaking a little bit more about universal masking, I think Glenn put it very well. We messed up in March. We told people as a healthcare community, you don't need to wear masks. We didn't understand the virus back then. We believed that the virus was likely very similar to another coronavirus that we'd encountered before, SARS virus. In that particular virus, if you were asymptomatic, you could not spread it. If you were asymptomatic, you didn't need to wear a mask. What we've learned since then, and we've learned a lot since March, is that you can spread COVID even when you don't have symptoms. If, for example, I came down with COVID today, if I was exposed to it today and got the virus into my system, it could take 3 or 4 or 5 days before I come down with symptoms. It actually can take 2 weeks before you come down with symptoms. But you start shedding virus actually about 2 to 3 days before you develop symptoms. And in fact, your peak spread of virus is about a half day to a day before you come down with symptoms. So this is very different than some of the other viruses that we've seen. And in fact, 80% of people either have no symptoms or have very mild symptoms and don't even really connect that they've had COVID. How do masks work? Well, masks work because, again, it's spread by droplets. That's the primary way it's spread. And when we cough or breathe or talk, these droplets come out of our mouth. And if we have a mask on, that does a wonderful job preventing those droplets of getting out into the air that we all share. Now, masks are more effective at protecting you from me than they are from protecting me myself. So masks are really an act of kindness. They're something we do because we care about each other and because we care about the community. Now, does anyone really believe that masks don't work? Well, I don't think so. I really don't believe that people don't believe masks work. I mean, if you think about next time you're going to have surgery, would anyone be comfortable having their surgeon not wear a mask? We know that masks prevent droplets coming out of the mouth. We know that masks prevent wounds in the operating room from getting contaminated. They also protect us against COVID. They work. There's really little debate about that. People spoke about the reopening. Reopening has also given us a lot of information that as we've reopened across the country, some communities have fared very well. Places like Boston and New York have seen continued drops in COVID virus in spite of reopening, whereas places like Arizona, Florida, Montana, we've seen significant spikes in COVID cases. Well, what's different? Well, in COVID in Boston and New York City, those communities were pretty ravaged in their early days with COVID. And so they were very worried and they took it very seriously. If you talk to people in those communities, as they reopened, people wore masks, people practiced social distancing. Whereas in places like Montana, most of us didn't know loved ones, didn't know friends who had died from COVID. And so people were more casual about it. But now that we're seeing it, now is the time that we do really need to reemphasize this. Now is a time to wear masks. And we do this, one, to protect each other, but also we do this to keep our businesses open. Now is also a critical time for our schools. If we're really careful and wear masks today, then we will be able to really be very safe about reopening our schools in a month from now. We also do this for the common good. It's the right thing to do. So thank you for the time.
All right. Thank you, Dr. Bob Merchant. Very good information, insightful. I hope everybody learned as much as I did in that one. I want to jump into a couple of questions if I could next. And I think to set the stage, one of the questions from Barry really might help us here. And Rayleigh, I'm going to turn this towards you. When we talk about the mask directive, we said, well, it's now the law of the land or law of the state. But what is it actually? Is it a directive? Is it a mandate? Is it a law? And what would be the differences so people understand exactly what this is?
That's such a good question, and I'm happy to answer it. I also wanted to mention, because I was a little too excited to answer questions earlier, and I didn't mention that I really want to recommend that folks rely on the covid19.mt.gov. That website, covid19.mt.gov, it has the directive itself. So you can look at the language and you can think about that and what it means. We didn't write it for lawyers, we wrote it for people. So the goal is to make it so that it is understandable and easy to follow. The other thing that's there that's really useful are the frequently asked questions. And I highly recommend consulting those if you're feeling worried. And also, please send us questions. If your question is not included in the frequently asked questions, send it to us. We will do our best. We have a whole team of people who answer these questions and think about them. Doctors, lawyers, folks with all kinds of experience. Okay, so the legal question. Here is the answer. Essentially, a directive is something that the governor issues in the context of an emergency. So the key is, can everyone still hear me? Okay, great. I just had something shift on my screen, want to make sure. So the key is that the governor has declared a state of emergency. And when the governor does that, it invokes a set of constitutional and statutory authorities. The Montana State Constitution reserves that power specifically to the governor. And then the governor is in a position essentially to protect public health and to do what is required in order to protect public health. The directive has the force of law for its duration. It is not a law that's passed by the legislature, but it is a legally enforceable rule, law. We can call it a mandate, we can call it a directive. It's essentially, the idea though is that it is legally enforceable. Our number one priority, and I want to be really clear about this, is education. We are not trying to criminalize people. We're not trying to arrest people. We agree with the sheriff's letter in the way that they are discussing. Essentially, we want to educate people first. It is a legally enforceable document, regardless of what else is out there on the internet. There's a lot of theories. I will tell you that it has been legally enforceable. This sort of thing has happened since 1918 and well before that as well. Public health is something that falls directly within the purview of a governor in a situation like this. Obviously, it isn't something that the governor normally wants to be sort of getting his hands into in just sort of your run-of-the-mill medical issues. But when we are facing a global pandemic, and I think that Dr. Bob really explained this super clearly, we are talking about something where it affects everyone in our community. We desperately need to protect one another and to create opportunities for businesses to stay open. And we need to essentially facilitate all of that. In order to do that, we need to have sort of consistent law, and we need laws that are protecting folks on the ground. The only other thing that I would add to that is that the Supreme Court has talked about this both back in 1918 with the Spanish flu, and also has talked about it as recently as only a few weeks ago. The Supreme Court's really clear that we've got this right. The 10th Amendment reserves this power to the states. It is absolutely essential that the governor have this power, and it is legally enforceable.
So let me just bring in really quick Gina Lervick, and she is with the county attorney's office. And Gina, can you add anything to that? We have a number of questions about the enforcement side and whether or not the Billings police is going to go on calls about mask issues, and can people be arrested? What are fines? Can you inform us about where you're at?
Good morning, everyone. Yeah, John, you know, I really have a lot to mirror Rayleigh's comments on the order, and obviously, you know, she knows best of the intent of it. The governor's order did a great job of empowering businesses, and businesses have the ability to, and the backing, to really take control of the situation. The signs are required, the masks are required. Beyond that, businesses get to decide how strongly they're going to push the issue when someone comes in, for example, and says that they have a medical condition. I couldn't agree more with Rayleigh's comments about, we don't want businesses to be demanding medical notes, to be, you know, pushing the issue where folks have medical conditions. And I did see there was a question about Hipaa and privacy concerns and all of that. Hipaa doesn't apply here for the most part, and so those signs are not appropriate. We're not suggesting this to any extent. However, much as you have any other consumer issues, this also isn't something where you want to go into demanding more proof. So enforcement, first and foremost, in Yellowstone County is going to come down to the businesses. What is anticipated by the order by the governor is, if somebody has a situation where they have someone who is belligerent in their business, who is stating, I'm not going to do this, and is in much the same fashion as any other issue that would come up in a business, refusing to leave. At that point in time, the business owner is welcome to contact police department, to contact the sheriff's department, and essentially to bring charges of trespassing against that customer. That is the primary, the strongest way that businesses can go through this. The sheriffs, the police department have made it clear this is not a situation where they're going to be picking people off the street. Hey, you're not wearing your mask. The most important thing about enforcement of not just this, but all of the governor's orders in Yellowstone County, it's not an issue where you will get a citation. It's not a situation where someone will write you a ticket and you're over and done. These are very, very serious issues, and typically what the county attorney's office will do, we investigate, Riverstone investigates, all complaints come through our office. We investigate every single complaint, and then we do what Rayleigh's talking about in terms of education. Most issues in Yellowstone County have been resolved through discussions with people, through conversations, through, hey, what's going on here? And almost all have come to the conclusion of, we need to do a better job as a business in order to protect our community, in order to protect our consumers. This is no different. The hope is that we can continue that dialogue with folks when there are issues. If there are not, ultimately what could happen is being charged with a crime. And that is a lengthy, very serious process, obviously. It involves going to court. It involves the court determining whether fines are appropriate, whether jail time is appropriate, what's appropriate under the circumstances. So I just want to stress and emphasize it's not as simple as, hey, we think you're doing something wrong, we're going to write you a ticket, and everyone will move along, which is another reason why this order is fantastic from the standpoint of really, as I said, empowering businesses to help their consumers make good choices. And I was trying to kind of answer a number of those questions. If I missed any, please let me know.
I think you nailed at least 4 of them there. Thank you, Tina. Appreciate that. Glenn, I wanted to bring you back into the discussion about some of the things that Arizona did, or did you see when when the mask controversy started to percolate up a little bit? Were there things that Arizona did as far as helping businesses get through this that you thought were especially effective?
Well, there's always been a very good line of communication in with the business community and our governor, Doug Ducey. He's a business person. He's the Cold Stone Creamery guy. So he has a very good pulse on what's going on in the business community. But I'll say the governor, I think like most governors, has always prioritized the public health. You know, he wants to make sure people are well, but to keep livelihoods as intact as possible. So the way I would answer that is that there's been just a continued dialogue with the governor in terms of what we need to keep the economy going to the maximum extent possible during a pandemic. And I want to really I want to really applaud the doctor for his comments, because the connection we've made is that, yeah, we understand that wearing a mask isn't natural for everyone. In fact, I got lit up on social media for wearing a mask incorrectly. I didn't put it over my nose. Now, I can't complain too much, given that I'm the person who posted the picture in the first place. But, you know, I also like how you're doing the campaign to let people know, you know, put it over your nose, put it over your mouth. And, you know, the message we're trying to get out there now is that to have a fully functioning economy and to get our schools open in person, we have to wear masks, as well as do the other things that the doctor said. And actually, I'm going to steal one of the additional things from the doctor, and that's to have the courage to tell people when they're doing something that might not be right, or just simply to remind them, which is generally speaking more likely the case. One thing that I'll just point out when you get to the enforcement side, I believe it's much, much more effective to have good, clear regulations or laws, whatever you would like to call them, but then to really have the business community, like the Billings Chamber and the Yellowstone folks, create that social dynamic. So it's like wearing a seatbelt. I think that that's going to be a lot more effective than sort of going after and taking to the Supreme Court, so to speak, someone that's acting in a way that he or she shouldn't be.
Okay, thanks, Glenn. I'm going to turn it back over to Dr. Merchant for just a second, because we had a question, and I'll let you expand a little bit on the kind of masks that you find to be effective. And I don't know if you know of a comfortable mask, but we'd sure like to know about it. And then how about shields? There are some people that are actually starting to look at shields as an option. What do you think there?
Yeah, so that's a wonderful question. So there's, with masks, there's 3 basic types. There's what we call a respirator and N95, and that provides the maximal protection. And if I'm doing a bronchoscopy, a procedure, which is really generating a lot of small particles, that's what I want to wear to protect myself. The standard surgical mask, that's what we see mostly in healthcare settings, and those are very effective at preventing the small droplets. Because there is a shortage across the country of surgical masks, we have asked the CDC, everyone's asked the community to use cloth masks, and those are effective. They're not as effective as the surgical mask. So there's kind of a gradation in terms of protecting myself. All 3 of them are pretty effective at protecting the small droplets from getting out. So any one of the 3 will protect the small droplets. There's a gradation in protecting myself. The question of the shields is a really interesting one, and unfortunately, it's like many things COVID related. We don't know yet. We are still trying to identify that one. The way it does is it works as a barrier. And if you go out to a lot of our businesses, if you come into our clinics, we're using plexiglass shields as a barrier to prevent these droplets. And we know those work. We know these shields work. Do they work as well as a mask? We don't know that yet. Currently in the healthcare setting, the recommendations are you can wear a shield, but that is over top a mask. That's not a substitute for a mask. Out in the community, when we're comfortable with a little less protection, would a shield work? The experts are debating that right now. We need more literature for me to give you a good answer.
All right, thank you. I see that we have our County Health Officer, John Felton, on with us. And John, I wanted to turn one question over to you that we had. And again, if you want to include a question, as we have just about 15 minutes left to go before our out, please send them in through the question and answer area of our chat today. John, employers have questions about when they have employees in a setting that may not interact with the public. Do they have to wear masks? And are you being contacted by many employers to give them some guidance on what they should do, either with employees that are interacting with the public or not?
Yeah, thank you. And also thanks to the Chamber for setting this up. So we have not gotten a huge number of inquiries from employers yet. We're starting to get those. I think where we're getting more inquiries are some of the signage issues that were identified a little bit ago. Whether the sign that says, if you're not wearing a mask, we'll assume you have a health condition. If that is appropriate in terms of meeting the signage requirement in the directive. The signage requirement in the directive is very specific. And so our answer has been that that sign that we've seen, and it's quoted on one of the questions, it does not meet the requirements of the directive. The directive simply says you have to have a sign that says everyone over 5 must be masked. So that we get a lot of those. And we've gotten a few. We're starting to get some complaints from individuals who are saying that either they've seen places where people aren't masked, they've seen businesses that aren't enforcing masking. We work very closely with Gina and the county attorney's office to manage those complaints. So we're actually developing. We'll have up fairly soon a online form that can be filled out for complaints rather than just calling. I think the other place that we're hearing a lot about is what happens if someone turns positive in a business. Does the business need to do make quarantine decisions? Does the business need to decide who needs to be tested? And we really push the let's let public health do their job in that regard. So overall, we've not gotten a huge number of complaints yet. I think that what Dr. Merchant and Glenn both said is really critical, and that is we really shouldn't be masking up solely because the governor told us to, or the local health officer told us to, or the CDC told us to. We should be masking up because we care about our community, we care about its economic vitality, we care about the health of its members. I think for me personally, a reminder is our local memory care facility that now 12 out of 55 people who are positive have passed away. Let's do this for them, and let's make sure that we don't have to release, as we've done virtually every day since July 6th. Riverstone Health has released statements of condolence because another person has passed away at that facility. Let's not do that. So I just really encourage people, let's kind of take it off the political question and take it off all that issue, and let's just get down to caring enough about each other to wear the mask and keep each other safe.
Thanks, John. You mentioned political questions, so I'm going to jump back to you, Glenn, on this one. Obviously, Arizona is a big, it's a red state, it's a Republican state, and there have been those give and takes with mask issues and testing and stuff that feel like they've percolated to a big political issue in Arizona. Can you tell me and the rest of us about how Arizona is maneuvering through what has percolated to be a pretty big political issue there?
Yeah, and I would say right now we're a purple state. We have a split congressional delegation, and our legislature could flip. So a lot of people look at it as a red state. We're not. We're purple, and if the trends continue in 4 years, we could even be a different color. But like a lot of states, we've got rural and urban counties. So I would say it's the way this mask issue has gone. It's been very different conversation in, say, Phoenix, which is the fifth largest city, than say in a rural part of the state. What has happened though, and I think this was alluded to earlier in the conversation, as Arizona has been in the barrel, so to speak, the public's views on masks and other mitigation efforts have changed. So the governor, to me, hit the sweet spot. At the moment, I think it was June 17th or June 18th, he gave the localities the ability to do the mask mandates. The public was ready and willing and eager in 90% of the state to accept it. So politically, I'll just say that it's been very well received. So a lot of the questions, this may be some good news for the people watching this broadcast. A lot of the questions in terms of enforcement really haven't come up because people have changed their behaviors. Right now, in most parts of Arizona, it's about as controversial and political as wearing a seatbelt. That may be your future, and I hope that's the case.
We have a couple of more questions, John. I'm going to just, maybe we can rapid fire a few of these. Dr. Merchant, looking at there has been some reporting about mask causing CO2 retention and symptoms. Tell us about that as a possibility, and are there risks wearing a mask for some people?
Yeah, the risks wearing masks is really very, very, very minimal. I mean, you can theoretically get a contact dermatitis from the mask. The chance of retaining carbon dioxide from a mask is honestly just not there. For your normal mask, normal standard mask, there's no problem with that. There's no problem with oxygenation. We have people that wear masks, 12 hours a day for their work, and so some of these people that work here are my patients who have severe lung disease, and they're able to wear masks, 12 hours a day. So masks are generally very well tolerated in a motivated individual.
Okay, John Felton, social norms helping out mask enforcement. How do you see that?
Yeah, I think this is something that Glenn just touched on that shouldn't be lost in the discussion. Most significant public health changes don't happen through fines and people going to jail and tickets and that sort of thing. They happen through social norming. We change our perspective of what is normal. And I think we're going to see that with masking if we keep going down this path of more of us wearing masks. And I would just point out to anyone who questions that, we've had the Clean Indoor Act for a number of years. If you go to a place where people smoke indoors, it's very, very apparent to you. And it's because socially, we don't do that. We don't smoke indoors. We don't walk into a hotel like Mike Nelson's hotel. We don't walk in there and the first thing we do is we smell smoke. In places where indoor smoking is still allowed, we do notice that very, very quickly. So we need to work through this process of normalizing. It's okay to wear a mask. It's just what you do. And I think as we go have more experience and more time, we'll reach that point. And that's one place I think the governor's directive really helps, because for those who maybe felt a little out of place or a little conspicuous wearing a mask, now nothing else we can blame the governor, right? He made us. So, but really, I think we need to normalize that it's really fine to wear a mask.
Dr. Merchant, cold and flu season ahead, is that too far out, or do you think it will have an impact?
Oh gosh, that really worries us a lot. That it's tricky enough managing this when there aren't other respiratory infections going around. When we get cold and flu season, it's going to be a lot harder to manage. There's a big push across the country to gear up. We know that flu vaccines are not perfect, but we know they work. We're hoping to have a SARS-CoV-2 vaccine sometime, probably in the winter time. So we really want to be gearing up and get ready to vaccinate aggressively for flu and then COVID when it comes out, because this is going to be very challenging dealing with COVID during the respiratory infection season.
John Brewer, I'm going to turn things to you for just a moment to see if you have any other questions that you've seen that you believe need to be addressed, and I want to make sure that we've hit on all the topics that we need to before we wrap up.
John, I appreciate that, and thank you. I think everybody's done an excellent job, and I would just challenge everybody who's out there listening. I think we had 104 at the peak. That you're now armed with facts and information provided by these professionals and this expert panel. And we as a community and as leaders on this call need to help with that social norm process and be seen wearing the masks and wear your sticker that shows that we are masking up for business. The reason we are doing this is, of course, to keep our businesses healthy as well as our community healthy and to get back to some normalcy. This is the one thing that professionals across the globe are telling us. We can have an impact. And armed with this knowledge now, I mean, it's almost criminal for us not to be wearing that mask to help our neighbors to do the right thing. And I just appreciate those on the call who are taking in this message, going to that website of yceconomicrecovery.org, downloading that material and sharing it with your staff and sharing it with those around you to help be part of this solution. As the governor said, you know, no shirt, no shoes, no mask, no service. That's the new mantra that we've got to get used to. And, you know, I think we're going to make a difference. This is that one thing. So much is out of our control right now. This is that one thing that we can do to help be part of the solution.
This isn't a debate format, but I did want to give our guests an opportunity to do a closing statement. Can we do that? Rayleigh, go ahead and wrap stuff up from the governor's perspective.
All right. I will just say that we are trying our very best to use the best tools available to us to support our business community and to support the health of individuals within our community, the whole state, Billings specifically. And we really want to empower businesses. We want to support businesses. And the bottom line is that we are here for you. And like I said a few minutes ago, covid19.mt.gov has the directive, the text of the directive. It also has the frequently asked questions, and we would love to hear from you if we are not answering your questions. And we want you to know that we're on your side. We want to keep businesses open and we want to keep people healthy. So.
Okay, thank you, Rayleigh. Dr. Bob Merchant, closing thoughts today.
Yeah, thank you. I'm just really excited about what I'm hearing, that this really shouldn't be a question or discussion about legality and trying to figure out how to enforce legality. This is about helping each other, doing the right thing for our community. This is one of these situations where the right thing for the economy is the right thing for your neighbors and the right thing for yourself. So just really proud of our community as one that really comes together well to help out its fellow members.
Okay, thank you, Dr. Bob Merchant from Billings Clinic. Now, Glenn Hammer, wrap us up from cool Phoenix or from Arizona, please.
It's a dry heat. Proud to be, and I'm sure John is as well, part of the U.S. Chamber, which has made wearing masks and getting chambers engaged a big part of what it's doing. About a week or two ago, as part of a U.S. Chamber-led effort, we sent a letter to the president, the vice president, the coronavirus task force, and the National Governors Association, saying mask mandates on the state and/or local level are justified and prudent. So my kudos to the governor of Montana, the governor of Arizona for heeding that advice and doing something that's in the best interests of all the people. Thank you for the chance to be here, and #MaskUpAmerica.
All right. Hey, thanks so much, Glenn. And a special thanks to Gina Lurvik from the city, John Felton from the county health office, John Brewer, and Mike Nelson. I'm going to turn things back over to you. Thanks very much for having this today.
John, we appreciate you facilitating the discussion. Appreciate all that Q2 does for us. Mike, I don't know if you have any closing comments. We'd sure like to wrap up with you if you do. Glenn, down in Arizona, I appreciate your leadership on the national front with the U.S. Chamber of Commerce. Rayleigh, thank you. Dr. Merchant. Mike.
Oh, thanks, John. This was a really educational and very interesting set of speakers and questions today. I'm excited to be a part of this. But you know what? Moreover, I'm excited to be able to do something good for my neighbor. If you take all the controversy out of it, wearing a mask ain't such a big deal. Just like they said, it's kind of like wearing a seatbelt. And believe it or not, I remember when they were optional. So I think as we go forward, we'll be able to do the good thing and the right thing and control this silly little virus. So thank you, everybody, for attending our seminar today.